Twila Brase. She is president of Citizens Council for Health Freedom, and you can check out Twila's website. Make sure you do that. Sign up for her newsletter, CCH Freedom.org. I hope you'll do that. Twila, last time we talked, we were talking about trying to get the real numbers. If there was is there any movement on getting the real numbers on Obamacare as to how many people are still in or out?
Well, there's no real movement. However, there is a man who writes. His name is Bob Lazuski, and he's considered an expert in the field that everybody quotes. And he basically said in a post, he has a blog called Healthcare Policy and Marketplace Review. He is supportive of Obamacare, but he is critical of the administration and of its failure to even understand the public in the implementation of the law. And so he said that he believes that there's only 6.5 million rather than 8 million. That was in a recent post of his. And one of the things that he talks about is that the majority of the people who have enrolled in Obamacare are, for one, they're not in the Obamacare program, but they're in the expansion of Medicaid or the Medicaid program itself, or the traditional Medicaid program itself. But he just kind of goes after the administration for the fact that they don't realize that the people aren't buying the program, and that's why it's really only the lower income folks that have signed on and not the middle class.
Now, wasn't there a report put out this week by CBO in reference to low-income families not signing up and facing fines?
That's true, and there are a variety of definitions, I guess, of low income. But the people who are Medicaid will not pay the fine. The people who are eligible for Medicaid will not pay the fine. But if you are a working low-income employee and you still have to file the form for the IRS for tax, right, at the end of the year, or I should say, by April 15th, then you will have to pay the $95 or up to 1% of your income. And they say, the CBO says that a million people will have to do that. And the CBO divides them into different categories of income, but there's still a million people, they say, that will have to, and they will be low-income people, and they will have to pay this amount of money, unless, of course, they can find themselves an exemption. But according to the CBO, they don't expect that they will find themselves an exemption.
That's interesting. I thought the exemptions were relatively easy to...
They are, but I think that the CBO does not recognize, for instance, the hardship exemption number 14, which gives everybody essentially the right to opt out of the penalty, and probably just isn't acknowledging that. But there's going to be about 30 million uninsured folks, and of the 30 million, there's going to be about 1 million who are going to have to pay the penalty.
You said, I heard you say this morning on your website, talking about the hacking of citizens' data into this federal agency's data bank now. Tell us a little bit about that.
Well, the testimony in Congress, there was testimony in Congress by 4 security experts. And those experts all said that when healthcare.gov was implemented and built, it was not built on a security framework. So it was never built with security in mind. It was sort of a rush job, as it were, because the administration was intending that Obamacare the law itself would convince the states that they had to set up their own websites for this enrollment and data collection process. But most of the states, didn't. Like 36 states said no, and so suddenly the administration had to pull this thing together for the October 1st open enrollment date of last year. And so they did it very quickly. As we all saw, they did it very poorly. And one thing that the security experts said was there was no security built into it. So 3 of them actually said that Congress should shut down healthcare.gov because all of the data is sort of sitting there, able to be hacked, able to be accessed by anybody who chooses to do it. So at some point in time, some hacker might indeed decide to go in there, and they sort of showed how that was even possible as professional IT experts themselves. And so anybody whose data is in healthcare.gov, either because you went in there and filed an exemption or you went in there and enrolled in something,
Right.
your data, including your financial data, your Social Security number, your family size, your race and ethnicity, if you put that down, all of that data that you enter, where you work, what your wages are, et cetera, is all waiting to be accessed by some hacker because they've never put the security in there. And in order to add the security, it's very hard, they said, to add the security features after the whole system has been set up. They said that you have to set it up with security in mind. It's very hard to retroactively do it. And that has not happened. There's been no, it's not been shut down. The data's not been deleted. It's all just waiting there.
Right. Well, some weeks ago or months ago, I guess, we talked a little bit about cancer patients being denied care. Has there been any progress on that, or are we hearing more horror stories from other types of patients yet being denied care?
Well, I think the latest thing on that has to do with the fact that that WellPoint has come out with this plan to pay oncology doctors, so to pay cancer doctors, $350 more for every patient that follows the insurer's treatment protocols.
Okay.
So
the
essentially, I'm
insurers,
just calling this a bribe,
right?
A bribe to cancer doctors. So treatment protocols are essentially a process or treatment pieces of, what kind of drugs, what kind of hospitalization, whether it's outpatient, inpatient, all of those pieces of someone's treatment where the insurer decides what they want the patient to have. Now, you realize, of course, that the insurer is not in the exam room. Right. The insurer doesn't know the patient. The insurer has no professional obligation to the patient. But the insurer wants to decrease the cost of cancer coverage, decrease the cost of chemotherapy, and would like to have all the doctors follow the insurer's protocols for treatment rather than doing whatever the doctor feels is necessary for the individual. So this is sort of a carrot approach rather than a stick approach to the, to the prescriptions, to the control over the doctors. Now, doctors don't have to do this, but as doctors' payment is reduced and physicians' payments are being reduced for treatment, and as more physicians become employees of hospitals and under the control of hospitals, I think that you will see some physicians that will look at this and go, well, actually, $350 per patient more would be kind of nice.
Right.
So that these things become things that weigh on the minds of doctors when what they should be doing is just looking at the patient and thinking what's best for the patient. But now they've got something else to think about. If they just follow the treatment protocols that the insurer sets forth, they could get $350 extra.
And these are all things that we've warned about over and over again. I know I did over and over again about quality of health care being diminished. And when we hear the president talk about lowering health care costs, sure, the government is lowering their costs because they're paying less, and they continue to pay less, and they're going to pay less next year than they are this year. Huge problem for quality of care. And I believe that is what's going to change the whole dynamic of this health care debate in 2016 elections, is that everybody's going to know somebody that has suffered at the hands of, lack of quality of care.
But,
So,
in the case of these cancer physicians, right, they're not going to tell their patients that they're following the
Right.
insurer's protocol.
right.
Now, they may follow the insurer's protocol for a while, and then if everything goes south, they may flip back
Right.
to whatever they thought was best. And, the patient may have no idea whatsoever. There's nothing requiring the patient to be informed about this. And this is one of the pieces of legislation we would love states to put into place. So if you know a legislator, if your listeners know legislators in your own states, a piece of legislation would be to require any doctor who's going to follow a protocol other than what he thinks is best for the patient to actually have to inform the patient.
Mm-hmm.
So if they're going to follow somebody's protocol because the protocol is sitting there and they're supposed to follow this protocol, or they'll be paid less, or their scores on these new quality reports on physicians will look worse, then patients need to be informed that the doctor is not necessarily following what the doctor thinks is best for the patient, but is following somebody else's protocol. That would just be a good piece of legislation for states to put in place as a sort of a informed consent,
Right.
a right of informed consent to how you're being treated. Who's really in charge here, the doctor or the insurance company, the doctor or the government? Let the patient know where the treatment protocol is coming from.
Yesterday, we had on the air the spokesperson for Samaritan's Ministries talking about health sharing. He was talking a little bit about their growth numbers and such. Someone asked a question of me afterwards, and I didn't get a chance to answer. I don't know if you know the answer to this, but are all the healthcare sharing ministries, are they not covering cancer patients?
That would be incorrect.
Yeah, that's what I told the person.
Yeah. No, if you go into one of the health sharing organizations when you already have cancer,
Right.
so you have cancer, you decide to join,
Yes.
then your cancer will not be a diagnosis that the organization asks its members to pay for because you came in after the fact.
Right.
But they will, like some of them, like Samaritan's Ministries, they will take that diagnosis and they will take that amount of money that you are in need of and they will put it out to the members and ask for charitable contributions to you,
Yes.
the person who has the cancer. And so I have heard that a lot of people have their needs met that way by extra contributions that the members give to people whose needs are not covered through the membership, but simply covered as a contribution out of generosity from the other members.